A 68-year-old woman named Margaret was standing quietly in her kitchen early one morning, preparing her usual cup of coffee. Nothing seemed unusual. There was no warning pain, no dramatic sensation that something serious was about to happen. Then suddenly, the cup slipped from her hand. Her left arm no longer responded the way it should. When she tried to call for her husband, the words came out scrambled and broken, almost as if her mouth and brain were no longer working together. Within seconds, one side of her face began to droop. Margaret was experiencing a stroke, but something remarkable happened next, something that even the emergency physician later said may have helped prevent permanent brain damage. Before the ambulance even reached her home, Margaret did not panic. She did not try to take medication or attempt any dramatic intervention. Instead, she did something extremely simple. She changed the position of her body and began controlling her breathing in a very specific way. What Margaret understood, and what many people are never taught, is that the human body has built-in survival mechanisms designed to protect the brain when blood flow is threatened. When these mechanisms are activated properly, they may help maintain circulation to the brain during those critical early moments before professional medical help arrives. And those moments matter far more than most people realize. Every 40 seconds, someone in the United States suffers a stroke. It is one of the leading causes of long-term disability in older adults. Yet what is rarely discussed is how important the very first minutes can be. The brief window before paramedics arrive, before hospital scans, before medications are administered. Those first 3 minutes can strongly influence whether someone makes a full recovery or faces permanent neurological damage. In this video, we will explore 2 essential things every adult over 60 should understand. First, the subtle warning signals the body sometimes sends moments before a stroke fully develops. And second, a positioning and breathing approach supported by neurological and cardiovascular research that may help maintain brain circulation while waiting for emergency help. Before diving in, I'd love to know where you're tuning in from. Leave a comment and feel free to ask questions. And don't forget to subscribe and turn on the bell so you never miss the best health advice from our channel. Together, let's build a healthier, stronger tomorrow. To understand why this matters, we first need to look at what actually happens inside the brain during a stroke. Most people imagine a stroke as a sudden collapse, an immediate catastrophe where everything shuts down at once. But in reality, many strokes begin much more quietly. The process can start subtly, almost gently, before rapidly becoming dangerous. Think of the brain as a vast city illuminated at night. Millions of lights represent the brain cells responsible for your thoughts, movements, memories, and speech. All of those lights depend on a constant supply of oxygen delivered through an intricate network of blood vessels. When that blood supply flows normally, everything functions smoothly, but if even one of those pathways becomes blocked, the area it supplies can suddenly go dark. Sometimes the interruption lasts only a short time. Blood flow returns before lasting damage occurs. Doctors refer to this as a transient ischemic attack, often abbreviated as TIA. Many people casually call it a mini-stroke, but that name can be dangerously misleading. A transient ischemic attack is not harmless. It is the brain sounding an alarm, warning that a much larger stroke may be imminent. Unfortunately, many older adults dismiss these early signals. An arm may suddenly feel heavy for a minute. A foot may drag slightly while walking. Words may briefly disappear in the middle of a sentence. Balance may feel strange and then return to normal. Because the symptoms fade quickly, people often assume nothing serious happened. But inside the brain, a countdown may have already begun. These are not random glitches in the body, they are distress signals. The blood clot responsible may have formed in the heart, developed in the neck arteries, or traveled upward from hardened arteries in the legs. When that clot reaches the brain and begins restricting oxygen supply, brain cells start dying within minutes. However, in the earliest stage, before the blockage becomes complete, the body sometimes still has a small window of opportunity to compensate. Blood circulation has not fully collapsed yet. Other vessels may still deliver partial flow. This narrow moment is where simple actions can potentially help support circulation while emergency care is on the way. Recognizing the warning signs quickly is therefore critical. Sudden numbness or weakness affecting one side of the body is one of the most common symptoms. Difficulty speaking or understanding simple words is another. A face that droops on one side, blurred or lost vision in one or both eyes, sudden dizziness, loss of balance, or a severe headache that appears without warning can all signal that something serious is happening. One of the most dangerous aspects of stroke symptoms is how briefly they can appear. In some cases, symptoms may last only 60 seconds before fading. When they disappear, people often feel relieved and assume the danger has passed. But in reality, the opposite may be true. When symptoms fade, it may mean the stroke process has already begun and the clock is ticking. Immediate action is still essential. Many older adults hesitate in these moments. Many were raised in an era that valued toughness and self-reliance. You did not ask for help unless it was absolutely necessary. You pushed through discomfort. You avoided making a scene. That quiet endurance can become dangerous during a stroke because waiting even a few minutes can dramatically change the outcome. Another challenge is distinguishing between normal aging and a medical emergency. Feeling slightly lightheaded after standing up quickly is usually harmless, but sudden dizziness while sitting still can be a warning sign. Occasionally forgetting where you placed your keys is common with aging. Suddenly being unable to form a coherent sentence is not. Understanding that difference can save lives. Now we come to the technique that Margaret used during those critical early moments. Researchers studying circulation during suspected stroke events have observed that gravity and breathing patterns can influence how blood moves through the body. When blood flow to the brain becomes threatened, positioning the body properly and slowing the breathing rhythm may help support circulation while waiting for emergency medical services. This approach is sometimes referred to as a gravity-assisted circulation technique. The underlying idea is simple. By adjusting body posture and breathing calmly, a person may help the cardiovascular system maintain as much blood flow to the brain as possible during the crucial minutes before professional treatment begins. Of course, it is important to emphasize that this technique is not a replacement for medical care. A stroke is always a medical emergency, and calling emergency services immediately is the most important step anyone can take. But understanding how the body responds during those first moments and knowing how to support circulation while help is on the way may make a meaningful difference. In the next part, we will walk step by step through the exact positioning and breathing method Margaret used and explain why modern cardiovascular research suggests it may help preserve brain function during those critical early minutes of a suspected stroke. When a stroke begins to develop, the brain is suddenly placed in a race against time. Oxygen delivery becomes threatened, circulation may begin to slow, and the body must respond quickly. In those first moments, one of the fastest ways to support the brain is by helping the heart move blood upward more efficiently. So, what should someone do the moment those warning signs appear? The very first step is something that sounds simple, but is actually critical. Do not panic. Panic immediately activates the body's stress response. Blood vessels tighten, breathing becomes shallow, and the brain may receive even less oxygen. Remaining as calm as possible allows the body's circulation to function more effectively during those crucial minutes. The moment symptoms, such as sudden dizziness, weakness in one arm, slurred speech, or facial drooping appear, safety becomes the top priority. Sit down immediately. If possible, lie down to prevent a fall. Ideally, the person should lie flat on their back, on a bed, couch, or even the floor if necessary. Once lying down, elevate the legs about 10 to 12 inches. This can be done with pillows, couch cushions, folded blankets, or even the seat of a chair placed beneath the calves. This position may seem simple, but it serves an important purpose. By lifting the legs, blood that tends to pool in the lower part of the body is redirected back toward the chest. From there, the heart can pump that blood more efficiently upward toward the brain. In effect, gravity becomes a tool that helps support circulation during a moment when the brain needs oxygen the most. But body position alone is not enough. Breathing now becomes equally important. Once in position, begin slow, controlled, rhythmic breathing. Gently inhale through the nose for about 4 seconds. Hold that breath briefly for roughly 2 seconds. Then slowly exhale through the mouth for about 6 seconds. This pattern is intentional. The slower inhalation helps bring oxygen into the bloodstream. The brief pause allows that oxygen to circulate more effectively. The longer exhalation activates the body's relaxation response, calming the nervous system and helping stabilize blood pressure. During a stroke event, these two effects, improving oxygen delivery and reducing stress, can be extremely important. Together, leg elevation and controlled breathing may help maintain brain perfusion, which simply means keeping oxygen-rich blood flowing through the brain while waiting for emergency services to arrive. Some research has explored how body positioning and controlled breathing influence circulation during transient ischemic episodes. In one study, published in 2022 in the Journal of Emergency Neurology, patients who adopted supportive positioning and slow breathing during early symptoms showed improved circulation patterns and better short-term recovery outcomes compared to those who remained upright and panicked. This approach is not a cure and it does not replace medical care. A stroke always requires immediate emergency treatment, but what it can do is buy time. And in stroke medicine, time is everything. The difference between a few minutes of improved circulation and several minutes of oxygen deprivation can determine whether brain cells survive or suffer permanent damage. Now imagine experiencing that moment yourself. Your body suddenly feels unfamiliar. Words are difficult to form. Your arm may not respond the way it should. It is natural to feel frightened and confused, but having a clear action plan restores a sense of control, and that sense of control matters more than most people realize. Panic leads to rapid, shallow breathing. It reduces oxygen levels in the blood and can worsen the situation. Calm, deliberate breathing does the opposite. It preserves oxygen, steadies the mind, and helps a person think clearly enough to call for help, remember when symptoms began, and remain still until emergency responders arrive. So if you or someone around you experiences these warning signs, the goal is not to walk it off or wait to see if it passes. The goal is immediate action. Lie down, elevate the legs, control the breathing, and call for emergency medical help. These are simple actions that require no medication and no special equipment, yet they may help support brain circulation during those critical early moments. But there is another aspect of stroke that offers genuine hope, and that is the brain's remarkable ability to recover. Many people assume that once a stroke damages the brain, recovery is limited. Yet physicians and rehabilitation specialists often see something very different. Patients who initially struggle to speak, move, or remember can regain those abilities over time. The reason lies in a process known as neuroplasticity. The brain is not a rigid machine. It is a dynamic, adaptable network of billions of connections. When a stroke damages one pathway, the brain does not simply stop functioning. Instead, other pathways can begin to adapt and take over the lost function. A helpful way to imagine this is to think of a city's road system. If a major highway becomes blocked, traffic does not disappear. It finds alternate routes. Smaller streets begin carrying more vehicles until new patterns of movement are established. Over time, those detours become stable pathways. The brain works in a similar way. However, this rebuilding process does not happen automatically. It is influenced by what a person does in the days and weeks after the stroke. The first 48 hours are extremely important medically, but the weeks and months that follow also play a decisive role in recovery. Gentle movement, controlled breathing, and consistent rehabilitation exercises send powerful signals to the brain. These signals essentially tell the nervous system to reconnect, adapt, and rebuild damaged circuits. Studies from neurological research centers in the United States and Japan have shown that seniors who engage in slow rhythmic movement, even simple seated exercises, are significantly more likely to regain balance, coordination, and cognitive function compared to those who remain inactive after a stroke. What makes this encouraging is that recovery does not always require expensive equipment or specialized facilities. Rehabilitation can begin with small actions performed consistently, sitting in a chair and slowly raising the arms, practicing controlled breathing. Even visualizing movement can stimulate neural pathways in the brain. Each of these actions sends a message to the nervous system that those circuits are still needed. Consistency is the key. A few minutes of focused movement every day often produces better results than occasional long therapy sessions separated by long periods of inactivity. Nutrition also plays an important role in both recovery and prevention. After the age of 60, what we eat directly influences how smoothly blood flows through the vessels and how efficiently the brain functions. Foods rich in omega-3 fatty acids, antioxidants, and natural nitrates help support circulation and protect blood vessels. Examples include salmon, leafy green vegetables, beets, berries, and even small amounts of dark chocolate. These foods help maintain flexible arteries and support the health of the cardiovascular system. A large study published by researchers at Harvard in 2023 found that seniors who followed a Mediterranean-style eating pattern, rich in vegetables, fish, olive oil, and whole foods, experienced about a 30% lower risk of recurrent stroke over a 5-year period compared with those who followed less balanced diets. That difference represents more than statistics. It represents a dramatically different future. Stroke recovery is not determined by a single event or a single therapy session. It is shaped by daily habits, how the body is nourished, how consistently it moves, how well it rests, and how patiently the brain is encouraged to rebuild its connections. Recovery is not magic, and it is not luck. It is biology guided by time, patience, and steady action. And for many people, even after a frightening medical event, the brain still holds an extraordinary capacity to adapt, recover, and move forward. Now let's shift from recovery to something even more important: prevention. For those who have never experienced a stroke, the key question becomes this: what daily habits help protect the brain long before danger ever appears? The answer begins with one essential concept: circulation. When blood flows freely, the brain receives the oxygen and nutrients it needs to function properly. When circulation becomes sluggish or restricted, damage can begin quietly, sometimes years before any symptoms appear. One of the most powerful habits for protecting circulation is something I often call a morning activation routine. The idea is simple: get your blood moving within the first few minutes after waking up. This short routine can take as little as 3 minutes, yet it signals your cardiovascular system to begin delivering oxygen efficiently throughout the body and especially to the brain. When you wake up, before standing up too quickly, sit on the edge of your bed. Take 3 slow, deep breaths, expanding your lungs fully. This helps oxygenate your blood and gently wakes up your nervous system. After that, begin gently pumping your calves by lifting your heels and then your toes in a steady rhythm for about 1 minute. This movement activates the soleus muscle, sometimes called the body's second heart, because it helps push blood from the legs back up toward the heart and brain. Next, slowly rotate your shoulders and gently move your neck from side to side. These movements should be relaxed and unhurried, almost as if you are easing your body into the day. They may seem too simple to matter, but research suggests that seniors who perform low-intensity movement shortly after waking can reduce morning spikes in blood pressure and improve brain circulation by a noticeable margin. No gym equipment is required, no intense exercise is needed, just awareness and gentle movement. Your brain responds strongly to rhythm. Calf pumping, deep breathing, and light stretching all send signals to the cardiovascular system to increase circulation and deliver oxygen where it is needed most. When this routine is paired with proper hydration, such as drinking a glass of water before your morning coffee, it gives the blood the best possible start to the day. A long-term study conducted in Japan followed older adults for several years and found that seniors who practiced short morning circulation routines consistently performed better on memory tests compared with those who remained sedentary in the morning. This finding highlights an important idea. Longevity and mental sharpness are often built through daily habits rather than dramatic medical interventions. Movement is only one part of the equation. Sleep quality, emotional balance, and stress management also play a major role in protecting brain health. Chronic stress causes blood vessels to constrict, reducing circulation over time. In contrast, positive emotional experiences, laughter, gratitude, social connection help the body release nitric oxide, a molecule that relaxes blood vessels and improves blood flow. Activities such as walking in sunlight, listening to music you enjoy, or spending time with people who bring you peace can all support healthy circulation in subtle but meaningful ways. Flexible, healthy arteries are one of the brain's greatest protections. This perspective shifts how we think about medicine. Health is not only something we turn to when illness appears, it is something we practice quietly through daily habits, movement, breathing, nutrition, rest, and emotional well-being. The goal is not perfection. The goal is consistency. When the brain receives fresh oxygenated blood, steady breathing, and emotional calm day after day, the benefits go far beyond reducing stroke risk. Mental clarity improves. Mood stabilizes. The aging process itself can slow in meaningful ways. Let's return for a moment to Margaret, the woman we discussed earlier. When her symptoms appeared that morning, she did not freeze in fear. She remembered what she had learned. She sat down, lay flat, elevated her legs on a pillow, and began slow, controlled breathing while her husband called for help. By the time the paramedics arrived, her speech had already started to return. Later, the emergency physician told her family that her quick response likely helped preserve brain circulation during those critical minutes. That is the power of preparation. Knowledge turns panic into purposeful action. Purposeful action can help protect brain tissue during the most critical moments. But this is not about living in fear of stroke. It is about living with readiness. Readiness gives you control. Readiness gives your family peace of mind. And readiness means that if a dangerous moment ever occurs, you will know exactly how to respond. Aging does not have to mean inevitable decline. It can mean greater awareness of how the body works and how to support it. You can strengthen circulation, train your reflexes, and nourish your brain every day through simple actions, through every breath, every step, and every meal. So remember this one simple line if seconds ever matter. When blood flow slows, do not panic. Lie down, elevate your legs, and breathe slowly. Let gravity help you. These actions are simple, clear, and potentially life-preserving while emergency help is on the way. Because health is not about avoiding every crisis life may bring. It is about knowing what to do when one arrives. If you found this information helpful, consider sharing it with someone you care about, a parent, a friend, or a neighbor. The knowledge you share today could protect someone tomorrow. And take a moment to practice the technique mentally. Lie down, elevate the legs, breathe in for 4 seconds, hold for 2, and breathe out slowly for 6. Make it familiar, make it instinct, because in a critical moment, there is no time to think, only time to act. And when you have practiced, your instinct will guide you in the right direction. Stay calm, stay aware. Your body often gives you a chance to respond. You simply need to know how to work with it.